Welcome to our next episode of the Breakthrough Autism podcast. Today I have with me Jeanette Chi, one of our wonderful supervisors and BCBAs at Breakthrough Autism, who works primarily with our teenage clients. So I'm so happy to have with us today Jeanette. Welcome, Jeanette.
Thank you.
And I'm particularly excited because I really want to chat about your experiences with servicing a very underserviced population, teenagers with autism, and your journey through that. Let's start there. With teenagers, what do you want the world to know in terms of clients who are adolescents, who have autism, their capabilities, what's important for them in terms of their learning, and where can providers go in terms of helping them?
So definitely teenagers, they do come with a different, kind of skill set that we need to pay attention to. We have those that, we want to focus on daily living skills, having them prepare job readiness skills, having them have those skills to be able to be integrated into society. So definitely when you are working with teens, it's important to consider, what would best benefit them in this stage of their life. Whether it be, helping them develop the independence. So learning how to, wash your face, do laundry, prepare a meal for yourself. Or it's those that, they are in high school, they're getting their credits, they're getting ready to get into a job. Okay, what can we do so that you are successful at that job in the future? I think those are definitely things that, we need to think about when we're planning like a treatment for teenagers.
Absolutely. It's that window into the future, right?
Yes.
And we think about that throughout the lifespan. I know you've worked with kids of all different ages, and we'll talk about that too. But in particular for our clients who are teens, that window into the future is adulthood, right? And a lot of the things that you just talked about is thinking about how do we lead them to the greatest level of independence that they're capable of, lead happy lives, fulfilled lives, dignity, right? Some of those self-care skills that you talked about and that I feel very passionate about too are not just about their independence, that's very important, but it's also like a sense of pride, not relying on another adult being in your personal space, right? If you need to get dressed or you need to feed yourself, these are things that I don't know if the general population fully appreciates. And sometimes families don't know this either because they haven't experienced it, that you don't just learn by virtue of getting older and the natural experiences when you're on the spectrum, depending on where you fall on the spectrum. Okay, granted, we know every individual with autism has their own unique needs. We tend to service a lot of kids who have more profound to severe needs, although we do help other kids too in terms of what they need. But for that particular population, it's that window into adulthood. So, you work with the teens themselves, you also work with the families too. What's important from your perspective and your experiences with the teens for families to be thinking about, for families to be working with providers on, from the family perspective when it comes to servicing their teenage kids?
Yes, I think families need to think about, like you had mentioned, this portion of their life is preparing them for adulthood. Like a conference talk that I went to, the presenter described it to me in such a great way where if you look at the different stages of life, this is preparing them for the longest stage of their life, which is adulthood. So, what can we do to help them be independent? And these skills, it does take time to develop, so it's not something that's going to happen, sometimes overnight or in 1 week. There are different things that we need to look at too when teaching them these skills. So definitely families should, talk to the BCBA that you're working with. Let us know what are areas that you would like your child to be better in at home. How could they be better independently in society? we could definitely work with you to help develop those goals, and we can also provide some suggestions as well too. You know, how can, yes, you want your child to be able to have a job. Okay, before having a job, are they able to have those prerequisite skills to be able to have that job? You know, being able to follow a schedule, being able to manage your time, being able to take a bus to your job.
For sure.
Right? So there's a lot of prerequisite skills needed to get to that big goal, which is great to have, and we can definitely work towards those goals as well too.
You know, one of the incredible things about ABA, one of our magical powers that I say of the many that we have, is the ability to look at those long-term goals, like job readiness or getting a job ultimately, and break it down into those small steps, right? Depending on each child's skills, each teenager's skills, and thinking about how do we get them there? How do we navigate that? There's the steps, there's the strategies. Example with jobs, there's their interests too. I love that you talked about transportation. We see things that maybe likely a lot of the families may not see in terms of gaps that need to be developed in order to get there. And why do we see that? Well, that's just our frame of
our perspective.
Our perspective, exactly, how we look at things. And we're very optimistic in terms of how we get the kids there in terms of their abilities.
And definitely, if the parents are not sure of what their child's like interest or future might be, we will definitely work with your child as well too, to find out what do you like, what are your interests, how can we use your strengths so that you are doing something that you are happy about as well too, right? No one wants to go to a job that they don't like or they're not passionate about. Our teenagers have many great strengths that you know, maybe we can, you know, advocate for the kids too. You know, your child is really good at coding. Right? Why don't we set you up so that you're doing something with computers, doing something with coding, so that they're happy doing, you know, a job in the future as well.
Absolutely. They can share that with us. And for those that maybe can't identify particular preferences vocally, we also look at, you know, where they enjoy spending their time. You know, if they're really interested in the kitchen and the food, like we might consider some type of work in restaurants or fast food or whatnot. We want to expose them to different opportunities based on their interests and expand their opportunities too, right? They may not know that something is interesting unless they have opportunities to explore that, just like us. You know, it's that's what we want for anybody, right? Is to have that fulfilled life and have some enjoyment out of what they do on a day-to-day basis. This is all incredible things that ABA can help with. In terms of figuring out, so we definitely ask parents, you know, where they see gaps in their child's development, when possible as well. The individuals themselves, the teenagers in particular, but even some of the kids we work with can share, you know, what matters to them and what they would like to learn. We definitely integrate that. Beyond that, though, we do see things that perhaps that a child or a teenager needs to develop in terms of their skills. So from a family's perspective, if they're looking like, how do you know like what my child needs to develop? How do we figure out what skills? We have these long-term goals, self-care. We talked about jobs. They can even be academic goals too. We have some teenagers who are aspiring to go to graduate school. Good for them. Lots, like the sky's the limit, right? So from a family's perspective, they're coming to you, Jeanette, you do this a lot. How do I know what's missing? I don't know. I just know that this is where they want to go. So how do you help families and the clients themselves identify where the needs are?
So prior to us, you know, developing a treatment, we do an assessment with the clients. Our assessment does help us identify some gaps where they might need to develop like skills. So definitely we use like assessments, and also just, I would say like our experience, you know, knowing, okay, the child is not able to, you know, wash their hands, for example. And that is such an important life skill. So, you know, teaching the parents, okay, maybe we need to kind of focus on that first. I understand your academic goals may be important and stuff, but just think about, again, the long-term, how this could have benefit your child, right? Being able to know how to wash their hands, being able to use the washroom, being able to dress themselves. Like, these are all very important skills that they need to develop in order for us to get to that long-term goal.
Absolutely. Yeah. And even, from start to finish, thinking about things from start to finish. So we do have some teenagers, for example, that can put their pants on, that can put a jacket on, but they might need their parents to identify, if it's colder outside, make sure you wear the jacket, or they might have to lay out all the clothes on the bed in order for them to do that. And we're there identifying whether that's through assessments, we're looking at different skills, or even just through description from the family. Oh, so how does he do that? Oh, whoops, hold on a second.
Yeah.
So he needs you to lay out the clothes?
Yes.
Okay, that's good. That's awesome. Let's try to take it up a notch.
Yes.
Right? Ideally, we want to always say our job is to put ourselves out of a job, right?
Yes.
So even for parents too, as your child's a teenager now, part of your job is going to be to put yourself out of a job.
Yes.
As your child's transitioning to adulthood.
Yes. And as they get older too, right? You want to give them their, personal space as well too. If you want them to be able to get dressed, you don't have to be there all the time, right? It gives yourself a break as well too.
Yeah, it's a win-win,
Yes,
right?
a win-win.
Independence is a win-win. That's true. I don't have kids on the spectrum, but my own experience with my own kids who are teenagers, it's like their independence comes with my independence too. It's amazing.
Yes.
So we want that for the family as well. Absolutely. So you work a lot with teens now on the spectrum, and one of the reasons why I wanted to have you on the podcast is because you do it with such grace and such compassion for the clients and also the staff that you train. Like, Jeanette, it's remarkable. I watch how you help support some teenagers who do really have moderate to quite severe needs, some of them, even including but not limited to some cases where we have some challenging behavior that we have to work through. And you do it in a way that is so optimistic, right? We have to sometimes work through it with our clients, but we have the belief that at the end, this is going to result in so much of a better life, right? Like if we teach functional communication, for example, ways to communicate needs and wants rather than banging your head. What a better life. So you do this on the daily. So how? Why do you do this? What keeps you going, Jeanette?
I think definitely, seeing the change that comes with the kids, right? They are able to express their needs better, right? We're able to see a decrease in these challenging behaviors. They're no longer, banging their head to express that they're tired, they're hungry, they want a break, right? Teaching those little things, is very rewarding. For me, I love seeing that. I also love seeing how, initially, it's tough, when they come into services, they don't have the skills, right? So we're, slowly, thinking, okay, how can I teach, communication? It does take time, right? Once we get to that stage, it's so nice to see even the staff, wow, they are now able to tell me, no, I don't want. I don't want to do this. I want a break. Or, wow, they just told me they need to use the washroom, right? It's so rewarding to see it from, the staff, hearing feedback from them and seeing the kids as well too, right? Some of them, we're still, working towards them being, more independent, but it's always nice to see these little checkpoints. Wow, last month we were doing one trial for a 5-minute break. Wow, now we're doing 3 trials, right? It's amazing to see the little progress that they make. It's very rewarding. Like you mentioned, the teen group is very underserved. They need more services. Being able to provide these services, the parents are so, it's a sense of comfort for them that they have a place to go after, that certain age point where, they might not be able to get services. So it's definitely nice in terms of the parents being able to have a place for their child to go to. And working with teens is, working with the little kids, it's nice, right? But working with the teens, it keeps you thinking about, okay, how can I best prepare them for adulthood, right? They're lots of fun to be around. They're lots of fun to be around. And it always keeps me thinking I mean, with any kids that I work with, it
Yeah.
always keeps me thinking. But with the teens, especially, it's you have like different challenges that you might not have with the little kids. They're bigger,
Yeah.
right? There's the kids, they don't know their size sometimes, right?
That's right,
So
yeah.
these kids, they're bigger. We have to be more creative now. We can't. It's not like a little kid where you can just, okay, you need to go to the washroom. Let's just pick you up and go to the washroom.
Yeah.
Right.
Yeah, it's different. Yeah.
So we have those barriers that we have to think about how to still have them go to the washroom,
Yeah.
but I can't just pick you up and go. There's also now thinking about like puberty, hormones,
Yes.
sexuality, right? That's something that the teenage group, that's something new that you have to think about when you're working with them, right? They don't know what's happening with their body,
Yeah.
right? So teaching them how to, maintain their privacy, and now how to prepare themselves for this new stage in their
Yeah.
life as well too.
Huge.
Yeah.
We have clients who've even had ABA when they were younger and did tremendously well, learned so many different skills, and then for a period of time maybe didn't even need treatment, which is awesome. We don't say that every child on the spectrum or every teen or every adult needs ABA by no means. In fact, like I said, our job's to put ourselves out of a job. Greatest day is when kids graduate. But we do see at times, and we tell parents this too sometimes as their children graduate from services, that's awesome. They're doing super. We want them to be able to learn from the natural environment. There may be phases in their life where they might have to come back for some support, and the door is always open. Puberty is a perfect example of that, right? Where something new comes up in development, and parents and adolescents don't need to go it alone. That's a really, really important one. And back to the whole dignity and independence, not being in a person's personal space, right? Bathroom is a perfect example of that. We want our young clients, we especially want our teenagers to be able to use the bathroom from start to finish with nobody in the bathroom. And we get clients who can't do that. And so that's one of our super duper important goals. Or even understanding the idea of private versus public is something we work on a lot. All life-changing things. So a question I get often from families, and even more so from the general public, from policymakers sometimes even, is, well, isn't it better to service the kids when they're younger? Or even more so, not even is it better? Well, the teenagers, like at that point, ABA doesn't work, right? Like it's for younger kids, right? So what would you say to that question, to that notion that, well, they're teenagers now, so that window, like one of the windows closed, so bye-bye to ABA. What's your response to that?
No, I don't think there's like an age restriction to ABA. Definitely like early intervention is important. If possible, if you can put your child into ABA services early, it's great. But there is no window, right? They're always learning. There's always many skills to teach them. And also ABA is not, just for like autism. You see it in like business. You see it in sports. There's no age limit. There's no window there as well too. So ABA is something that can be applied to so many different areas. The teenagers, unfortunately, there are some who don't get that. Don't get services when they're young. So what does that mean? That if it's only for little kids, then they're never going to get any help. So I think definitely if they can be in services when they're teens, they have the funding for it, for sure, continue. We can work on so many skills. And there's no limit. There's no age. There's no, this is it, that's end.
Absolutely. Because I think sometimes people don't really fully understand that ABA is really just the science of learning. Right? You're teaching skills. It doesn't matter what age. And we're seeking to teach meaningful skills. Just like you said, and I couldn't agree more, absolutely. Early intervention, you can get your child in when they're young. That can make a monumental difference at the right number of treatment hours per week. Amazing. But there is no window. The window doesn't shut. There's no finite time frame for learning. We learn throughout our lives. And the proof is in the pudding. The proof is in the things that you're teaching, that our team is teaching, that people are teaching across this globe to teenagers with autism using ABA. I mean, that's it. Like, there's, there's no trick to it or anything. Just come and meet some of these teens who have learned really meaningful things through ABA.
Yes. And everyone's different perspective, right? Like every child comes with different strengths and needs. Little things like even being able to request for help, a sentence, it's a big difference for the family, right? Or just being able to dress themselves, put a jacket on. There's so many different skills that we can teach that can help them in their day-to-day lives. Yeah.
That's one of the things for me that over my career has been so eye-opening. Is before I was working with kids with autism, when I was much younger and earlier in my career, studying psychology, I was really interested in child development, and that's kind of what led me through multiple different points along the road, ultimately to working with children with autism through ABA. But before I was working with kids on the spectrum, I didn't have a full appreciation for all the quote unquote little skills that human beings acquire throughout the lifespan that they just learn, right? You don't really fully appreciate that pivotal skill, that putting on the jacket, how monumental that is until, I think, for me at least, till I started working with individuals on the spectrum. And then now I see it everywhere. I'm like, did you see what that kid, he brought that toy to his mom. That's shared enjoyment. That is amazing. That's a huge skill. We work on that with, some of our kids. Or conversation. Did you notice that, he doesn't just answer questions when you're talking to him? He also, like, if I make a statement, he asks me about my statement. If I say, oh, I just got back from, I don't know, the cottage or something, then he's going to say, how was it? Right? I didn't ask me about the cottage, So these are things that we work on with all of our clients that we have a different appreciation for, right? Because of what you said, you're thinking, how do I teach him? What are the learning trials? How am I going to get the staff to do it? How do we work through some things that maybe sometimes other people have told the family is unteachable even, right? So from that perspective, we work with the families, but you also work with the staff. So what do you say to staff that you're training or supporting during those times that it's like, okay, we got to work through this, right? It could take thousands of learning trials. It's hard to say. Every individual that we work with is different. So what are some of the things you do or share with staff to help them keep going too?
I think definitely reminding the staff that if there's any challenges, it's not intentional. It's not targeted towards you, right? It's for the child to express a need, or it's something that they've learned that this is how I get what I want, but obviously it's not in appropriate ways. So just reminding the staff that it's not directed at you, it's not intentional. If you need to just take time for yourself, you can give us a shout. Go ahead, take a few minutes, get some water, take a deep breath, and, come back into the session. You come with a more open mind, more fresh. The child also is able to, you're more there for the child during the session. And then just reminding staff as well too, there's many different strategies, right? So if you find that there's something not working, feel free to let one of us know, and we can problem solve around this, right? There's always going to be new maybe challenges that might arise during your session that we can't obviously predict the future. Every day is different sometimes. So just letting staff know as well too that there's always a solution to any challenges that might come up in the session. Again, it's not overnight that it's going to be fixed. It does take time, but there's always some sort of strategies that we can use to help them. And definitely the teens to remembering to like engage with them in like age appropriate.
Yes, very good.
Age appropriate. That's as much as, you know, you might not think that's a learning, like it's not written out that you should do this, but that's how they learn, right?
Yeah.
If you're engaging with them in hugs and tickles, they are learning it's okay to go
That's
and
right.
give hugs and tickles to anyone that they see. But when you are, you know, 15, 16 years old, 6 feet, you're coming up to a stranger asking for a hug, a tickle, that's not going to be okay.
Yeah.
Right? So remembering to, you know, engage with them age appropriately and, you know, continue to have fun, right? Talk to them about their interests. What is it? Is it Minecraft? Is it some YouTube videos? What is it? You'll also get to learn more about them, and they learn that you are a fun person.
Yeah.
You are not just the person that's coming and telling them to do hard stuff.
That's right.
You are able to, you know, have fun with them, and they might, you know, you create that better relationship with them, and they remember you as the person that, you know, knows all the cool YouTube videos versus you're the person that's coming to make me do hard stuff.
That's right.
So remember to, you know, always have fun with them during your sessions. It will make your session be easier, and they will love coming to see you as well.
That's great advice. Excellent advice. You know, for someone who's starting out, learning the ropes, right? Again, keeping in mind we do tend to service kids who have more moderate to severe needs. But even looking at it across the spectrum, the optimistic viewpoint that there is always a solution is a wonderful one. It's good for families to hear that too,
Yes.
and individuals themselves, right? Like we have some teenagers that we will say, like, you've got this.
Yes.
Like, okay, it might take us a bit of time to get through this, but we believe in you and you've got this. And if it's not working, we're going to regroup and figure out a different strategy that might work better for you. That is, I think, one of the most incredible messages about ABA is that we are incredibly optimistic about each individual's ability to learn.
Yes.
More so, I think, than definitely the general viewpoint. Historically, it was behavior analysts that actually really changed the viewpoint of the capabilities of individuals with developmental disabilities.
Yes.
Because it was behavior analysts who saw the capabilities, the potential in the individuals they worked with, and then they figured out how to get there. Then they demonstrated that, in fact, they could learn a given skill or multiple skills, or ultimately completely change their trajectory. So this is like such a good theme to share with staff, with parents, and beyond, right? With our staff, though, they're in there and they're in it every day.
Yes.
So understanding that is part of the experience.
Yes.
That's just, you know, we can say, I would love for it to be the case that it was just sufficient to present a learning trial and then they get it.
Yes.
But also just to think about, even with general learning for any of us, like that's not going to happen.
And also to consider that there's many different factors as well too. There's the community, you know, they go to school, there's different family members that they might interact with. So sometimes, you know, what we're teaching them, it might be demonstrated maybe here, but it's not demonstrated at school. Or everything that we're teaching them there, it gets maybe, you know, it gets reinforced at, you know, at the center. But then when they go to school, all the negative behaviors get reinforced, and, you know, we've got to take a few steps back. So it's also important to collaborate with these other professionals and try to find ways to have them practice those skills in their setting as well. It's only going to help the child learn faster if everyone's on the same page, practicing the same things, and also being flexible with, okay, you know, a school setting, they have 10, 15 kids.
That's
right? So, okay, you might not be able to practice exactly what we're doing, but here's a little modified version of it. Still teaching the child the same skill, but in a different way as well.
Absolutely. And understanding, I think it's good for aspiring supervisors, you're very good at this, to understand that those environments are so different. And that is why sometimes some of these challenges do arise in other situations, given just the dynamic environment and the resources or whatever is at the school's disposal. Of course, we know, you know, teachers that we interact with in EAs, there's such good intention there. Sometimes there's a challenge around, oh, the other kids are, noticing something that maybe is not the best way to get attention.
Yes.
So let's be creative, work together, collaborate, and figure out how we can have this individual, whether it's a teenager, whether it's a child, show up as their best selves at school.
Yes.
Capture those moments,
Yes.
deliver lots of reinforcement, or what I like to call the party when they happen. So some of that is brainstorming together and collaborating, figuring out how it's going to work.
Yes.
So that it works not just at our center, but well beyond. So
Yes.
there's a lot of different dynamic points that are true for the kids, and especially for our teenage population as they enter into adulthood. We got to be thinking about not only the high school that they're in, but also where they're going.
Yes.
Right? Like there's a lot of different things to be thinking about there, and working with families and schools and beyond. And those are all such important things to consider. So to be able to do that, you have to have a certain skill set to be able to help support all these, different hats that you're wearing, right? You're wearing the supervisor hat, you're wearing the help the family hat, you're wearing the collaborative hat, and you got your BCBA in part.
Yes.
That was one way. Also your, supervised field work and working within the center. So now if we take it back to where it all started, what made you want to pursue that path of acquiring those skills to ultimately, work as a supervisor, as a BCBA within the field? What sparked that fire inside of you to say, okay, I'm going to do this?
So when I was in school, one of my co-op opportunities was being in a multiple exceptionalities classroom, which just happened so that all the children in that classroom had autism. So in that classroom, my role was to be with the kids who were nonverbal, maybe needed a little more support. So I was there for about 4 months, and every day we're going in, okay, we're teaching the same stuff. And okay, some of it the child had mastered, they were great at it. And then some we were going nowhere. So even during my placement, I was like, what am I doing?
Yeah.
Why am I teaching this child to match shapes and they have no idea? They're remotely nowhere close. They're not even placing the one picture with the other picture. They're just holding the picture and just dropping it.
Yeah.
So teaching them, there has to be a better way. So after I finished my co-op, okay, went on Google, typed in, okay, autism, right? Okay, treatments for autism, and stumbled upon ABA. Okay, great. Reading through it, sounds interesting. Has to do with, working with children, which I wanted to do, and psychology aspects of it, which is what I was interested in. Applied at Breakthrough as an instructor, and, okay, learning all this is cool. I'm able to see all these different changes that are happening with the kids. And especially a client I was spending 15 hours a week with him. And I was able to see the change that ABA makes. To this day, I always just think back, I'm like, wow, that day where, the child was able to learn how to use a spoon and was feeding himself applesauce, I was like, this is amazing. This is the best. All those times I'm spending, sitting next to the bathroom waiting for him to go to the washroom. Now he's toilet trained. That is amazing, right? And I still interact with this client to this day, and I'm like, you know what? I was a part of this. I was able to teach them this skill, and just reminding staff to, this boy,
Yeah.
why he's able to use the toilet. I spent so much time sitting with him. Obviously, it's not just me. It's at that time, the team that was staff that were on his team, the BCBA that was supporting him, right? But just it was a part of a team, and I was a part of that journey as well. So being in the instructor position, okay, I was learning, okay, to do this, but I was like, okay, I want to learn now how I can be a part of this. So I went to go on to pursue my master's, and then completed the hours needed to obtain certification. And now I'm here. and I still enjoy it every day. This job is there's always something new. You're never bored.
That is so true.
There's always something to learn. And it's just so great to be a part of this field, doing this job. Yeah. That's how I got it.
And it started with like that little voice in your head saying,
yes,
there has to be a way.
There has to be a way. Yes. Right? And I found the way, and it works.
Yeah.
And you find out that you can teach so much with this. It's always great to see the change that we're able to make.
Yeah, absolutely. Yeah, so the way is ABA,
yes.
Right? Like there's the way. ABA is the way for clients who need that specialized learning, right? And that's, I think, actually, because you were in the classroom, this is an interesting piece of the story here, is that you were in an educational setting, which is tremendously important, and the work that the schools do and the teachers do and the EAs do is just like bar none, so important for so many children across the globe. But there is sometimes for some kids, and most of the kids that we work with, actually all of them, but at some point hopefully they don't need it anymore, is that it turns into beyond the needs of education. They need treatment. They need therapy. They need specialized, customized programming to make those neurons develop. Those pathways, those neural pathways need to form. And the general education setting, even within a multiple exceptionalities classroom, and they were doing the best they could, like you were saying, the kids were learning some things, but here this kid is trial after trial after trial matching, and he's not getting it, right? That's where treatment comes in for any families that are watching, or even the general community. It's just like any other form of treatment or therapy, you know, where it's not enough to, let's say, I don't know, go to the gym to correct something in your back or something. You might need physiotherapy or chiropractic care or whatever that might be. There is a place for treatment and therapy. And I often say to families who are trying to figure out their way or navigate, you know, if it was sufficient to put your child in a general education setting or when they're younger, daycare, I would love that for your kid too. I would love that. I would be the first one to say go and do it. And in fact, logically, we wouldn't exist if that was sufficient. It's just not enough, right? That's where therapy comes in, that customization that you learned through implementation. And then you took the next step, which is now I want to be able to help be a part of the treatment planning, right?
Yes, just to learn more, right? Because it's always, as I said, this field is always, there's always something new, right? So, okay, how can I, you know, want to teach this, but, you know, maybe the parents are not in at that time as an instructor. You know, how can I teach this? Right? It's not a goal that the parents want, but it's a learning opportunity. How can I teach this child this skill? So being curious, wanting to learn more, and then learning from my supervisors at that time. Here, look at this research article, take a look at it, and learning more. Oh, wow, this research talks about these different things. How can I now implement it? So definitely like being curious and wanting to implement those changes definitely helped me want to pursue my certification.
That's awesome. And do better for the kids. And then there's another layer here, which is also the families, right? So like we also figure out through supervision and through lots of conversations is, okay, so family has certain high priority goals, and those are really important for the family. And I know you do this, and the team does this so well, is figure out how we're going to break that down into small steps and navigate that path. But then there's also an element as a supervisor that there are things that we see that maybe the family doesn't see, right? Sometimes I say it's like the blind side, right? We see the blind side. And so trying to figure out how to best teach that to the child. And then there's a second part, which is engaging the family to have those conversations to say, you know, we noticed X, Y, and Z. Like we all need to be on the same page. We're not going to go teach something that you're not cool with. But did you know like X, Y, and Z is actually pretty important and your child's, isn't developed in that area. So how do you help steer those conversations? Like, what do you want families to know about things that maybe they're not seeing? And, talk about how do we develop a plan that comes together between the things that are important, primary, top of mind to you.
Yes.
Then there's some other stuff. How does a conversation like that go?
Definitely, the goals that the parents have, yes, they're important. We will practice those, but I think we also have to break down the skill to the parents as well too, and asking them, do you feel like your child has, this skill, or why it's important to have this skill before we can tackle this bigger skill? And I understand, like, also the parents, like, you, in the end, the treatment decision is yours. Okay, we will hold off on maybe my goals first. I will, like, work on yours, and when we're ready, we can have the discussion again and come back to it. Okay, now how do you feel? Are you comfortable with me teaching your child this skill?
Yeah.
Okay, if you're still not ready, can we do something else that maybe requires my goals, but not directly following those type of goals? So, like, maybe, like, you're not ready for your child to learn how to fold shirts. Okay, no problem. How about I teach him to follow, like, basic instructions?
Right.
So that in the future, if when I ask, okay, can you go get me that shirt? They're able to do that skill. So again, collaborating with the parents, finding a middle with them, and coming up with those treatment plans, like, with the parents.
Absolutely. Yeah. And those are some tricky conversations that you don't always learn in a textbook, right?
Yes.
But it's important to have those real conversations. I personally find a lot of those conversations with families are, I didn't even think about that. I didn't even see that. Thank you for sharing that with me, right?
Yes.
And some of it is, toilet training is actually a really good example of this. Any child beyond the age of, like, 4 or 5 who's not toilet trained, I'm like, let's go. As soon as I got to get him. And we've had 16-year-olds that are in diapers that have come into our services, and we
telling the parents, hey, you save on diapers.
That's huge, because they are expensive, especially these days.
Yes.
But maybe they say, okay, you know what? Let's wait till the summertime.
Yes.
Because we'll say, look, there's, like, a time investment that we're going to make, but it's also a time investment for you. So, those are the kind of things that's, beyond the client's treatment planning that's important. And when we say, like, our goals, what do we mean by that? We mean it's not for our own benefit.
Yes.
It's for, we're seeing we feel is that window into the future. For teenagers, again, into adulthood, and we're saying, look, like, this is a really important goal that I'm really passionate about. That, if your child learns this is going to be a game changer, right? But again, depending on where the family's at, depending on where that client is at, and of course, not all clients can, but when possible, clients can also assent or consent to the process. Again, a lot of the clients that we work with aren't always in the position to be able to do so, but if they can, they're part of it too.
Yes.
And looking at, okay, how can we meet halfway? Or, okay, let's plan for the future. And like I said, a lot of those conversations end up in, gosh, thank you for telling me. Like, I know I had X, Y, and Z as my top priorities. I wasn't even thinking about that. Wasn't even on my radar, right? That's us. That's what we see, the blind side, right? And that's something that yourself and so many of us can bring to the table for families.
And I think definitely, telling the parents, okay, why don't we teach them this? And sometimes the parents, no, they won't do it. They can't learn this. No, give me a chance. Yeah. I will teach them, right? And then once they're at a certain point, I will show you how you can practice this at home with your child as well too. And yes, get that feedback. Wow, they're now able to do this at home, or they're now cleaning up their room, or they are now preparing a meal. Oh my gosh, it's might not be perfect, right? The kitchen might be messy, but wow, they put the bread in the toaster and they were able to make themselves toast.
Amazing.
The kitchen was a mess, but no problem, right? So it's also giving your child a chance, giving us a chance to teach your child that skill. And as I said, like, once they are at a point where we can show you, or even if they're not 100% there, let us teach you how you can help your child do this skill at home. as well.
Help get them there too,
Yes.
as a family.
Yeah.
Absolutely. So I've had a number of moments like that in my career where, I'm not sure. There was one where it was a little boy and it was riding a bike. And there was actually another story similar, a little girl teaching her how to ride a bike. And the family, it just came up like very casually in conversation. I forget, summertime, and talking about bike riding and how, they were going to go, but their, child couldn't come, or maybe the siblings were going to go and, he was going to play in the backyard or whatever. And it's like, hold on, what? He can't like ride a bike? Is that something that your family does? Yeah. Do you want him to learn how to ride a bike? Well, yeah, but I don't think it, no, like it's too much. And, it's some of the kids that we work with even have some motor challenges, or even beyond that, just he won't even like get near the bike, or just forget it. We got a lot more important things to work on, like you. Why don't you give us a shot at this?
Yeah.
Let's just try. Like there's, he's going to go outside anyways for breaks at the center. When he's outside, maybe we're just going to give it a shot. To them riding the bike and me finding out because, the parents have sent a video of him or her on the bike, right? It's like, this is amazing.
Yeah.
This is amazing. And now the whole family is going on bike rides together, and it's good for exercise. And then you see, our client with like the biggest smile on their face as they're riding their bike because it's like freedom or whatever, they're enjoying, right? So, those are some moments that I've had. Any moments that stick out to you in terms of successes that surprised you or even were really touched you or really meaningful in terms of the kids that you've worked with?
I think definitely the kids, a client that I work with is now in high school and has a job. Learning if someone was to ask me, how was this child like a few years ago?
Yeah.
You would have not imagined where that child is now. So I think that's definitely something that I always think back on, that, the challenges that we went through have now led this child to having a job.
Yeah.
Them being more, or even like when they're no longer needed at our center, right? The child has graduated. Now they're going to go to school full time. Those are some great moments that I remember where the parents will say like, I really don't want to leave. And like, we're actually telling, okay, you can go now. Yeah. You don't have to stay anymore. Your child, like, they're capable. They have the skills to go to school full time now. Those are definitely some moments that, I always think back on. And yeah, it keeps me going to be able to tell those parents, okay, you don't have to come back anymore.
Yeah, no, really. Yeah, it's time to go.
It's time to go.
Yeah, that's a good conversation to have.
Yeah,
right?
yeah.
It's hard sometimes because, like you said, even with the families, it's a trust and a comfort to know their child is in a good place, and they know that for certain that they're learning things. But there is a point, which is a really good point, when it's okay, time to graduate. That conversation is amazing.
Yes.
And your story about the young man who has a job. I mean, you think about that from so many different perspectives, the perspective of the skills and obviously what that will lead to in the future. But even for himself, like the pride that he can have for himself in terms of contributing and doing something meaningful for other people even, that he will have for the rest of his life.
Yes, and whenever I do ask him about his job, he always has something like positive, and he's so excited to always tell me about his job. And it's just great to see that he feels like a part of like society.
Yeah.
And that he's able to contribute. He had mentioned his first paycheck. I think he bought pizza for his family. So, the families would like their child to experience these moments, right? No, which parent would not want to, my child bought me dinner today with their first paycheck, right? So to be able to have these type of moments for their families is always so nice to see and hear about.
And I like how you described it as like, if you would have seen that child, I don't know, let's just say I'm making this up, like 5 years ago or 3 years ago, you would not have imagined that future. You wouldn't even believe that's possible. But behavior analysts believe that's possible.
Exactly.
And that was a lot of really good, successful, high-fiving party opportunities. But there were some days that was tough.
Yes.
And we still the next day came back. And not only did we believe, but the family also continued to persist through the learning, right? Which is mostly good times, to be frank. Like we do a good job at setting up kids for success, but there's going to be some days that are tough, and we all keep going. We think about that. I sometimes even think about, because as a psychologist, I have like the diagnosis like phases too in my mind, and I think back to like that family when they got that diagnosis. I don't know, would they have thought that that's possible, right? So for them to have that journey of like, I'm not sure what's possible for my child, to now my child's buying pizza with their paycheck. Like, oh my goodness, that's it. Like, I'm done. I'm retiring. I don't need anything else. Like, I've accomplished everything I need to in life.
Yes.
That's amazing. It's amazing. It's amazing for other professionals too, right? To hear that early on. It's like, you're going to have that story too.
Yes.
Okay. It's going to take some time. It took you a couple of years, right, Jeanette, to get there.
For sure.
But you're going to have that.
Yes. I think definitely people who are entering the field also, like you might not, again, have like my story where the child now has a job, but take a step back, look at what you have done so far for the child, right? Okay. First you were helping them, hand over hand folding like the shirt. Wow. Now you're guiding them by the elbow. Now you're like, now you're just placing the shirt for them, right? See the little wins that you have in your everyday sessions with them. It's very rewarding, right? Sometimes it's hard to see those little wins that you have, but it exists. It's there.
It's there, absolutely. Hang on to those, right?
Exactly. Yes.
All those wins, no matter what they are, for that given client, will last them a lifetime.
Yes.
That's the other thing I think that's so incredible about what we do, is that how many people can say that they've changed the trajectory. They've done something that will last that individual lifetime that they otherwise wouldn't have gotten.
Yes.
Right? That folding of the shirt, that using the bathroom, that saying like, I'm thirsty, I want water. I can guarantee people, because I've also seen the other side of this, for those that need treatment, which is again, not all those on the spectrum, but for those that do need it, if they don't get it unequivocally, like they're not going to get those skills. These are skills that they wouldn't have acquired had you not been in that child's life.
Yes.
Which is just, what a beautiful thing.
Yes. It's sometimes I do think back to my time in my placement classroom, right? If I could go back in time and teach those kids what I know now, they would not be needing help to be fed during lunchtime. They would not need help getting dressed. They would not need help in the washroom, right? So I always think back to, if I could go back in time, I would go back and help those kids. And now I know I am able to make a change in the kids that I see every day, and, just want to continue making a positive change in their life and in society as well too.
Yeah, absolutely. That's a really amazing thing. I do think about that too. Even older clients that I've worked with, it's like, oh, I just want to go back and run that program now, but it's amazing that we have that drive. You have that drive to, we're going to keep going. We're going to impact as many kids and families that we possibly can.
Yes.
And that need it. Right?
Yes.
Like that's the beautiful thing about ABA.
Yes.
So.
And we might not have the answers to everything, but there are other professionals in the ABA field that, focus on feeding, that focus on like more like pica, like those type of challenging behavior that we are open to collaborating with as well too, right? We don't have the answers to that, but we can maybe find the answers for you, refer you to these professionals that can, better help your child as well too.
Absolutely. Within ABA and even beyond.
Yes.
We won't hesitate to contact, one of the kids who had challenges with the bicycle. It's like, okay, well, we can also bring in the OT, the PT as well for the motor pieces, and we're working together. We work on the learning pieces. Whatever it takes for that child, right? It's that viewpoint of they're capable. We see the learning, like what they learn and how they learn, and all those different pieces are very dynamic depending on each. We know that not every teenager we work with is going to end up with a job at the end. That's okay.
Yes.
Even if they're in a group home congregated living environment, or they're living at home and they still need significant amount of support from parents or siblings or whomever, we still want to make that the best quality life that we can, right?
Yes.
It doesn't matter what the ultimate final destination is. It's what matters is the fulfillment, the quality of life, the dignity, the pride. Like I can see it on I'm sure you see it too. Like you can see on the child's face or the teenager's face, even if they can't articulate, like, yeah, I did that.
Yeah.
I got this. Like,
exactly.
Sometimes they'll even be like, okay,
I did
move
it.
out of the way.
Yes.
I don't need you anymore.
Yes.
Like, that's amazing. Great. You don't need me. I love it. Or just like, I need, the teenagers, like, they'll tell you, like, I need some time.
Yes.
I'm like, yeah, that's what my
That's
16-year-old son would say too.
Yes.
Good for you for saying that,
Yes.
These are all things that they wouldn't have said had they not gotten ABA.
Skills.
Absolutely. We've talked a lot about from the child's perspective and engagement and helping staff through that as well. We've talked a bit about the family. Any thoughts you have on for new people entering into the field or even beyond, what's worked for you in terms of engaging the families? Advice, because this is something, and the reason I bring this up is because, again, it's not really something that we address in our textbooks. It's something that people like yourself that do it really well learn through experience.
Yes.
So what would you share with people, with professionals to say, okay, and to families too, because families need to look out for this as well.
Mm-hmm.
How do we work best together? How does that work for you? What are some tips that you have for that?
To have the family. So definitely for, I guess, BCBAs or instructors, I guess know what the family goals are. And also then working with the family, how can I teach you this? Okay, we can do little 5-minute windows throughout the week before you come pick up your child. Let me quickly show you where your child is at so that they're able to practice it at home. Or if you're not able to, like you have work, you can't come pick up your child. Okay, we can set up some sort of video call. I can show you when your child is next to you. It's not a lot. We're not going to throw the ABA terms at you. We can make it simple for you. We can make it so that you're able to practice it at home with them. And yeah, we definitely work together with the families to, for you to be able to practice those skills at home.
Yeah, this is important for people to hear too, because again, when you're starting out or maybe you're pursuing higher education, there's certain technical things that you learn. Those are all important, right? And even families sometimes when they're trying to figure, they're Googling or whatever for better or for worse, and they might stumble upon some very technical pieces. And sometimes I'm actually amazed by some of the things that they've learned, right? All important things. But then there's reality, okay? So everybody has to somehow come together, common ground, meet halfway, because it can't be all or nothing on both sides, right?
Yes.
We can't expect, if you don't get your 10 trials of data family at home, you can't teach that skill or whatever, or don't take those data, right? Okay, where's the 10 trials come from anyways? If anybody's watching, that's all made up. So anyways, that's just easy because you can calculate a percentage really easy, right? Well, we've learned since then it's not, 10 is not the magic number, right? Now, do we want families to have as many learning opportunities as possible? Absolutely, right? But what's feasible? Those are the kind of conversations that practitioners have to have with families, and vice versa. Families have to feel open and forthcoming to say, you know what? I would really love to come in every week for a session and do some parent coaching, but look, unfortunately, some of us, are in situations where they're not getting funding and they have to work to actually have their child in treatment. So I can't do that. But yeah, like you said, the videos, coming up with alternatives.
Different creative solutions, right? I can show you a video, me practicing it with your child, and then you can watch it at home. You can try it. Any questions that you have, feel free. We can chat quickly about it. As well too, maybe sometimes we're teaching with a textual. Okay, you're not always going to have a piece of paper around you writing down the answers. Okay, how can we have you teach that to your child with the tools that you have? Okay, maybe we can have it on your phone. You can present it to them, a picture. You can maybe have it written out somewhere so that it's handy to just present it to the child, right? There's many different creative ways to have your child be engaged, have the parents engaged. We just have to find a happy medium for the child, the parents, and ourselves.
Yeah. So one thing on both sides, like from of what you're saying, like from the provider perspective, also from the family perspective, if you're looking for providers and trying to understand like how's this going to work, of course, there's like all the technical stuff that's important. There's logistical stuff. Is it going to work? You know, for some families, dropping off and picking up their kids from center is the perfect solution. For other families, it's not. That's okay. But there's another third aspect here, which is the opportunities to interact with the supervisor of your child's team.
Yes.
There has to be opportunities for conversation. You have to feel like you can have those conversations. We're not always going to agree on everything. That's okay. Ultimately, like you've said, and I always say this too, like families ultimately have and the kids too, if they're able to, the yes or no here, right? In terms of consent or not, fine. But we want you to have informed consent, important. So informed means we have to have some conversations about things. There has to be opportunity for that. This is really important, I think, for providers to think about and families. Like if you can't even have the time slot to have the conversation, like we can't just work with your kid. It's not going to work that way.
Exactly, yes. And also it's important when we do show the parents these skills that they're learning, the parents are able to provide us with feedback that, hey, actually at home, this is not like, maybe this won't be as feasible.
Yeah.
Can we try it this way? And that gives us the opportunity to tweak it so that they're able to better practice it at home as well too, right? Like I've mentioned before, like skills such as, you know, washing hands. Okay. They use maybe like a towel and then they throw it in the garbage afterwards. Or they in terms of folding clothes, there's so many different ways of doing it, right? Okay, I'm teaching a way that you're not gonna teach your child that way. Okay, let me tweak my strategies so that they're able to do it how they would do it at home as well too, right? So having these conversations with the families provide us with insight as to how better provide treatment.
That's good. And the fact that they could see what was, okay, this is how we're teaching it. That opportunity is like, that example is a good example because in a lot of public places or schools or centers like ours, it's paper towel. Okay, well at home, that's great. You can throw out the paper towel, but at home I got the cloth towel. You don't want to be throwing that out. Okay, so now this is another element we didn't think about. Now we got to teach, okay, when it's the paper towel, you throw it out, but when it's a cloth towel, you don't.
Yes.
Though all of that is born out of the conversations, right?
Yes.
There's so many little things. Toothbrushing is another example, right? When do you rinse? How much you whatever, all these little things. They're very specific to different people's experiences.
Yes.
So we have to have those conversations.
Yes, and also like the cultural aspect too, right? That's another like layer that we need to always think about as well too. Like, you know, I might do it this way, but my home, you know, culturally, we don't do it like this.
That's right.
We, like an example, teaching a child how to wipe after a bowel movement. But we have certain cultures that, we use a bidet at home, right? Yeah. So, okay, how can I teach your child that element at the center, right? Also reminding us as professionals too that we need to, you know, have those conversations with them. Okay, how can your cultural practices maybe at home, how can we incorporate that into treatment? Because that's important for the family.
Absolutely.
As well,
and
right?
I would have no idea if I didn't talk to a family about that.
Yeah.
So those are all, you know, we get, rightly so, we get really hyper focused on the client's skills.
Yeah.
So important as a field, but we also have to think about those skills don't live in a little like isolated vacuum. There's this like whole ecosystem that child lives in. And so we have to think about how any given skill intersects with the ecosystem. And the other tricky thing that we have to think about is it's not all or nothing, right?
Yes.
The paper towel, the cloth towel is a perfect example of that sometimes we kind of got to teach them both.
Yes.
Which then I go back, oh my gosh, like there's so many complications of the things that we have to teach the kids because it's not just the rule.
Exactly.
There's this or that. That's okay. That keeps us thinking. And we got to, you know, teach that to identify, like in that example. paper towel, cloth towel, right?
Yes.
We got to teach those different pieces. So those are all, it keeps us on our toes,
Yes,
right?
that's why I said ABA, this job, every day is something new. You're always learning. There's never a dull moment.
There's never a dull moment, that's for sure. So if you could go back in time, because we talked about maybe going back in time, right? You're starting your career, you're thinking about, different things and starting off in this profession. And in fact, you have this experience with new staff
Yes.
who start. What's some of the advice you would give to yourself starting or even to new staff as they're starting? What are some of the things that we should keep in mind
Yes.
to do the best we can, and because the
Yes.
kids deserve that.
Yes, it's definitely going to be very overwhelming in the beginning, right? If someone who has no idea what ABA is, you're learning all these acronyms, you're learning all these strategies. It's going to be very overwhelming, but that's okay. That's just how it is, right? Feel free to reach out for like support. What do you mean by this strategy? What do you mean by this? And we can further explain it to you. And you're gonna have those hard days, right? Again, the child's behavior, it's not intentional, it's not targeted at you, right? We need to remind ourselves to take ourselves out of the picture sometimes. And definitely it's important to have self-care for yourself, right? When you're not at work, try your best to take care of yourself so that when next day you go back into that session with that child, you are ready for that child, for that session. I think that's definitely like important as well. And continue to learn more, right? Even myself, I'm still learning all the time. When go to any like conference, if there's any talks that interest me, that's not necessarily about my, I guess, working with teens, like learning about like sports, how sports and ABA work together, learning about like brain injury and ABA. There are always little pockets in those talks that I've been able to apply back into my teaching. So, be open to the different things that ABA can teach you, and, you will continue to like learn.
Yeah, and it's fun too. It's
It's
interesting to think about its application in different ways.
Yes.
Absolutely. Those are all good tips that help people keep going.
Yes.
Right? In terms of the longevity of a career like yours. Because you've been, practicing for how long now?
Now it's 6 years.
6 years. I knew it was more than 5, but I lose track after certain milestones. That's amazing. 6 years is amazing.
Yes.
So from the family perspective, same question, because you've also had experiences with kids of all ages, really, where families are entering into services and they're early in the journey.
Yes.
Right? In terms of treatment, they have goals, right, for their child. Important to hear those goals. But what advice or what would you want them to know? How do you help families navigate, early on in treatment? Like, what are some of the key things that it's important for them to consider?
I think definitely like for families, like we are open to hearing the goals that you have. And again, to be open-minded about maybe the programs that like we have also as well, because we see things like the prerequisite skills, that might be needed for you to achieve that big goal at the end. And then for families to like, come and see what your child is learning so that you are able to, apply it at home. You are able to provide us with the feedback that, this is working, this is not working, so that we are better able to plan out your child's treatment as well too. And as well as for families to, do your research on, does this provider maybe have like the credentials, right? Do they have the credentials to be able to maybe serve my child maybe who has like, pica or like, a brain injury or something? It's definitely like important for families to think as well too.
Absolutely, yeah. So see what they're learning.
Yeah.
Have the conversations with providers, very, very important. The seeing what they're learning too, I've also found with that at times families are actually surprised.
Yes, how
at
much
what
their child can do.
They go, I didn't know he could do that. Like he's writing his name,
Yes.
like perfectly. He's been, every time I try to get him to do any homework at home, he won't even pick up a pencil. It's like, now you know.
Now you know, right?
So,
yes.
But it's also, it's what they're learning, but how we're presenting it. Like there's so many elements to it, right?
Yeah.
That perhaps there may be showing us things that they're not showing you just by virtue of you altering something small in your environment. You might be able to see that.
Yes.
And then you can share that with other people, or we can share it with educators, or even absolutely, beyond, right? But it's a dynamic relationship, right?
Yes.
And then of course, absolutely, the credentials are important. And to that point, I think that's important for families to think about is, we all have our own expertise as professionals, right? I don't say that I'm expert in all things ABA, for sure not, because as we've talked about, ABA is the science of learning. It's even well beyond autism. But I'm not even all things expert with ABA and autism, right? So a good provider will really understand their expertise and know their limits and their boundaries of what they can practice. I think that's really important.
Yes, and being open to collaborate with those professionals that have these expertise, right? I can't maybe help your child with feeding. I will reach out again and, find out different strategies to help your child, be more open in terms of eating different food.
Absolutely, yeah. Really understanding what your scope of practice is and connecting families if needed to other professionals. It is, it's a red flag if anyone's presenting themselves as being able to service. I've been doing this for over 25 years. You've been doing it for over 6. There's no way we would say, all things being equal. I mean, that's why we have an initial, chat even with families before they even enter into services to understand what they're looking for. Very upfront. For sure, I'm confident I can help you with that. That one there, it's a really important goal. You should talk to so-and-so, or we can work with you, but we're going to need so-and-so. And that can even evolve during treatment, right? Like we could be servicing all elements of skill building, and then all of a sudden, got it. That one there, we got to think about somebody else helping. So families should be aware of that, ask questions about that.
Yes.
Even from our own experiences from working a lot with younger clients to moving into the teenage population, there's been supplemental skill building consideration. Programming that you do, it looks very different, of course, based on every individual, but also kids versus teens, right? So that's all, it's not just we're doing the same thing that we're doing with the 2-year-olds, where we can actually help them on the toilet, for example, as opposed to our 13-year-olds. So families need to think about that and look for that.
And definitely, the little kids, we want to make treatment fun and engaging for them. So maybe we'll have them match their favorite cartoon characters, but we can also do that with teens, but obviously in a way where it will be beneficial for them. So a way of matching, I'm gonna have you match the utensils that you're able to put away the dishes after.
That's right.
So teaching again those maybe foundational skills, but in a way that's age appropriate and will help them in their lives.
So give me some more examples of that, when you're thinking about teenagers, right? Because as families are, we've already talked about the population is underserved, unfortunately. That's one piece. Now they're looking for providers, right? We know that the treatment planning and the implementation should look different, obviously depending on each individual client, but also some greater considerations or themes for teenagers as opposed to kids, some things that you've had to think about a little differently when it comes to programming.
Yes, definitely. Again, the example of matching, right? Okay, I want the child to learn to be able to match, but is it appropriate for them to be matching shapes, colors? No. Why don't I teach them the skill of matching, the utensils? Teach them the skill of non-identical matching of sorting clothes. The shirt goes here. Okay, here's another shirt that goes there. Even teaching them prepositions. I'm not going to teach them with toys. Maybe I'll teach them, okay, you need to put the cereal box behind the milk or something along those lines, right? So how to make it age appropriate for them, how to make it meaningful for them, and how that they're able to apply it in their day-to-day life.
Yeah,
well.
absolutely. It really comes down, I think that's important. Like some of the goals may be like on the higher level, similar. Matching is a good example of that, right? And because matching, but it's matching as it relates to daily life,
Yes.
right? Functional communication as it relates to daily. We all still play, even as adults. Hopefully, we all still have our fun and do leisure
Yes.
activities and stuff like that. But again, that may look different. It should look
Yes.
different, right? We're not sitting on the carpet with the train set. Now, if they're really into trains, awesome. Even if they're older, that's cool. Like we can
Yes.
still use the trains, but what that looks like should be embedded into that bigger framework of where they are in terms of their life span, what phase of life they're at, all those things we have to be thinking about. It's dynamic because you also
Yes.
want to think about their interests, and it's
Yes.
okay if they have some interests that maybe aren't developmentally exactly at the same stage as like some of their peers. That's okay.
Yes.
But we're trying to figure out how to make it meaningful and natural as possible within their day-to-day lives, right? So those are all great examples, and I see it like unfolds at the center.
Yes.
And a lot of it is really functional. We think about just what is this going to look like
Yes.
for them, even beyond. And I like the thought of like adulthood is like the largest stage in life, so we better get ready for
Yes.
that, right?
Yes.
Like it's really something that unfortunately a lot of individuals with autism are very underprepared for, and
Yes.
that's not just because they're under, that's the fault of society hasn't
Yes.
prepared them for that.
Yes.
And then they're there for what, hopefully a really, really long time.
Yes.
But we want to make that life enriched for them,
Yes.
right? So I go back to, where we started the conversation, which is, you work with the population now primarily, still work with some littlers too, but a lot of teenagers who are underserved, right? This is something that you do, and you do it so well. I'm so blessed that I get to work with you. And so as the last question I really want to ask you is, what do you want people to know about teenagers on the spectrum, even beyond that, like where ABA can help them, but what should the world know about teens with autism, given what you know?
Like you mentioned earlier, there's no like limit to what they can learn. The learning is going to look different, but it will be beneficial for them, and they will be able to learn all these different skills that will be able to help them in the future. Again, working with teens, there might be like little challenges that come up here and there, but there's always going to be like a solution to these. And as much as possible, like get your child in ABA treatment during this time. If they haven't had it before, it's like an investment into their adulthood. Yes. They might miss some school time, but just think about how much they're learning here that will be able to help them in the future.
Absolutely. Yeah. The impact that it will make in the quality of their life.
Exactly.
Right? Thank you for sharing your story with us. I hope that people that are watching, if there's professionals out there thinking about a career, that they think about teens too, that your story serves as a blueprint for some of the wonderful impact that we can make with teenagers on the spectrum. And we need more people. So this is a cry out there to people to say, like, come and join the field, and not only join the field. And yes, we need professionals to work with the kids. We need a lot of professionals to work with the teens because they can learn. There's a bright future for them should they get the right treatment in place during the teenage years, and they deserve it. Their families deserve it. They deserve it. And you are proof of that. So thank you for everything you do.
Thank you.
For sharing your story, and it was wonderful to have you.
Thank you.